Hello guys, my name is Jake Klein. I'm a pediatric nurse practitioner here at OKC Kids Urology in Oklahoma City. And today we're going to do an educational video on bladder irrigation. If you go to our website, there is a couple of videos about bladder irrigation where I discuss the supplies you need and the technique. And again, the reason we do this, generally with our bladder exstrophy patients, they've had bladder augmentation, and so they've had a piece of small bowel, ileum, intestine patched onto the bladder, and that segment of bowel will create mucus. And we want to be able to irrigate that mucus up and get it out of the bladder so that we don't have problems with bladder stones. You can get colonization in the bladder anytime that you're catheterizing. It's a dark, moist, warm environment, which is what bacteria like. And so kids that are on intermittent catheterization can have just normal colonization. Bacteria that lives in the bladder that doesn't make them sick, but it can make the urine cloudy, it can make it smelly. And so irrigating allows you to clean the bladder and eradicate all the bacteria and the sediment to decrease smell and those type of things. And so we have a patient here today that we're going to practice on. And he's a bladder exstrophy patient who's actually had reconstruction with a bladder augmentation. He has not yet learned how to do his own bladder irrigations, but we teach the kids how to do that so they're very independent. His father does them for him now, and so I'm gonna do the irrigation to show you the technique. The things that we're gonna need, you need number one, a catheter tip syringe that holds about 2 ounces of fluid, 60 mLs, and a catheter will fit right on the end. We're going to be using a 16 French catheter. It's a little bigger, and these work great for the kids that have had augmentations. They have catheterizable stomas. These have much bigger eyelets and a bigger bore, so it helps drain some of the mucus out even when they're cathing. And so we'll need our catheter. We're also going to need a little bit of sterile water or sterile saline. And again, the bladder is not a sterile environment when you're catheterizing. It is colonized, and so we do have supply chain shortages where we can't get these sterile supplies. And so we have a lot of kids that just use distilled water. You can buy it over the counter. It costs $1 for a gallon, and you can irrigate with that without problem. What we're going to be doing, and you'll see me doing this, we're going to have 60 cc's or 2 ounces of fluid, and we're going to instill that into the bladder. Once he catheterizes and empties, we're going to instill that through the catheter. It's going to go into the bladder. Once it's in, we are then going to pull back on that to make sure that we don't have any resistance, because the tip of this catheter's got these eyelets. If they get up against the bladder wall or they slip down too far, if you were cathing in the urethra and they got in the bladder neck, well, tissue can obstruct that. And when you're pulling back, it creates suction, and that can be uncomfortable for some of the patients. It's like a little shock. And so we want to use a technique that I call the piston pump technique. We're going to have all the fluid in, then we're going to pull back, make sure we don't have resistance. And then we just simply bring the catheter back to the 10 mark, maybe the 15. Some people like it at the 15. And I'm going to go 10, 5, 10, 5, 10, 5. We're going to create a piston pump motion. And if you imagine this is a bladder that's got a bunch of sediment in the bottom, I'm going to be doing that piston pump motion. It's going to stir all that stuff up like a snow globe. And before it settles to the bottom, after I do a certain amount of pumps, and again, no certain number, once you feel you've stirred everything up, well, we're going to draw that out of the bladder. And then we're going to irrigate again if we need to, if it's not clear. The reason that I leave this little 5 cc window down at the bottom is so that you can see how well you're irrigating. You can see the floaties. And so we're going to go ahead and have our patient catheterize for us, and he's pretty much ready to go. And so this is a soft style 16. It goes through the stoma real nice. I'm going to pass this off to him, and he's going to put that catheter in. I'm going to let you put that in. And he's got a catheterizable stoma. You can see he's got a little bit of keloid scarring around there, and that's another topic that we'll talk about. Can you see it there? There you go. You just go ahead and put it on in. Sometimes these guys have a little tightness around the stoma, and it takes them just a minute to get things going. He's actually done some laser treatment on his keloid scarring, which has made it much better. And he wears a catheter plug. We have a video about that as well that helps keep it open so it doesn't get tight. And so we just emptied his bladder not too long ago, so he's not going to have a whole lot of urine in there. He's pretty empty. You can see it just barely coming out of there. But you want to get that urine completely empty before you start irrigating. We're going to have us a brand new catheter tip syringe. And what I like to do is just take a little bit of fluid, and you'll see here we've just got a little stainless steel basin. You can buy these at Walmart. They're 99 cents. Stainless steel helps reduce bacterial growth. It's a great thing to use for your irrigation fluid. You can just pour a little bit out, put the cap back on. You can reuse those as long as you're not sticking stuff inside them. They'll last about 30 days. So we're going to now draw up 2 ounces of that fluid. I always flip it upside down and take the bubble out. It's not going to hurt anything. You can fill the bladder up with air. It won't hurt it, so the bubbles don't hurt, but I like to get them out of there. There he's got a little bit of pee coming out. He gave me a little Valsalva. He's just pushing a little bit out of there, so we'll get him completely empty. You can see it bobbing back down in there, so he's pretty empty. He's giving me one more little squeeze there. See, you can see him pushing some of the bubbles. That tells you that you're empty. Bubbles are great. That lets you know you're empty. Okay, so we're going to irrigate now. I'm actually going to hook on here. And we're just going to instill this fluid. I'm going to turn this where everybody can see the letters and numbers. So we're instilling the fluid into the bladder. Now, one thing, if you start to see fluid leak out around the stoma, that just means that your catheter is not pushed in far enough. So just stop and push it in a little bit further. You just go in at a regular rate here. Bladder exstrophy patients are extremely hypersensitive in the bladder neck area, so we instill the fluid at a nice steady rate, but most kids will figure out how quickly or slow they want to put it in. The next thing I'm going to do is I'm going to pull back, and you can see I'm pulling back and I don't have any resistance. If I had resistance, it would be stuck. What that tells me is I need to move that catheter and find that sweet spot where I don't have any resistance on those islets. And so now, the way I like to hold this and teach people is, hey, if you're right-handed, your left hand's going to wrap around that syringe. I'm just going to use 3 fingers. 2 go here, 1 go here. I always tell people, just tuck these away. And then you can see my elbows are kind of into my sides, and it allows me to have better leverage. Instead of having a very unsmooth movement that's more herky-jerky, I can now go 10, 5, 10, 5, 10, 5, and I have now created this nice piston pump motion, and he's pretty clear. You know, we're not seeing a lot of sediment, we're not seeing a lot of mucus, but again, we just emptied him out and got some mucus out. You can see a little bit of maybe floaties in there. But again, no certain number of pumps that you do. I feel like I've pumped it around enough to stir it up. So in one smooth motion, I'm now going to take it out. So I'm just pulling that fluid back. And I'm going to slow down as I get into that 40, 50 area, just so I don't pull back too hard and pinch him, because the bladder's collapsing down. Now note the bubbles coming through my catheter. That's very important to see those. That lets you know that we're getting pretty empty. And so I'm just going to kind of keep pulling a little bit. And then basically it's just air. And now I know that I'm done. And so what I do is I fold that in half so it won't leak out on me. You take this, you squirt it on out, put it in the toilet, put it in your basin. If you feel like you need to irrigate again, that's not clear, there's still sediment and mucus, just draw up another 60, hook it back on there, and irrigate one more time. When you're ready to take this catheter out, anytime you're cathing or irrigating, if you fold these in half, it is very good technique, because as you can see, when I now take this catheter out, there's still going to be a little bit of urine trapped in there. If I didn't fold that over, then this goes all over him, and he doesn't want that on him. And so we've taught him good technique. And so he folds that over when he takes it out. And then you can have a little tissue to wipe off your jelly. and he's now empty and irrigated and happy as can be. And so once again, my name's Jake Klein, pediatric nurse practitioner here at OKC Kids Urology. This was a little educational video on bladder irrigation with a bladder exstrophy patient who's had a bladder augmentation. So tune into our website. This is really good information for you guys. Thanks so much for tuning in.